Hey everyone, it's time for a DrRic Sunday Q&A. If you see down there, I'm not sure if you can see it, but there's an archery range here off of Mount Hoy, and you'll only hear occasional instruction, but usually it's silent, especially as the shooter prepares to let go of the arrow. Just like biathlon, the guys that ski and shoot in the Olympics, they have to learn to slow down their heart rate immediately right after coming off of a long ski. So it is important to have that heart rate variability. But today's questions and answers, I think I'll base it off of, I just recently had a kid that came in with traumatic brain injury, but it was presenting itself as anxiety. So he was getting treatment with his psychiatrist and his psychologist, his primary care doc, but they weren't getting anywhere. And he was just becoming more anxious as age would increase. So I think there's a lot of great things when you declare traumatic brain injury and you get the workup and you get the team involved, psychotherapy, neuropsychology, primary care, psychiatry, and neurology. That's a lot, but you have to have a team to support you, especially if the current place that you're at isn't getting you anywhere. So I think you can apply that same thing to anybody with disease. I have Isela, she has every symptom in the world, and a lot of it is being based on anxiety. But it's hard to focus on anxiety treatment when there's so many other organ systems that are offline. Heart rate's off, brain is not working properly, gut is screwed up, menstruation and thyroid are off, digestion can't get the absorption of the fuel, so it's really complicated. But the more chronic and the more entrenched you are with the disease process, it's kind of hard to sift out which one is the priority to treat first. But I still think it comes down to my old basics. I have this acronym called T, thinking, eating, and activity. I think those are the three things that most patients come to me for as far as lifestyle coaching. You can go to your doctor for lifestyle coaching, but I don't think you're going to get anywhere, because as doctors we're taught in traditional Western approach, which is usually if there's a problem, there's going to be an algorithm that you can apply to the problem, the symptom, and it'll get your patient out of the office faster. Unfortunately, that's the way it is. To take care of the masses, you have to apply an algorithm that's presented from the masses being studied. But when you apply general ideas to individuals, I think you're going to have a problem. Well, I think it'll work for some people, but it'll hurt other people. So, especially if you're well entrenched in your disease process. So, it is important to have some form of thinking. So, we'll go off of the thinking, eating, and activity. The first thing I would try to encourage is Zen mindfulness. And I just interviewed Bhante, the monk who founded Blue Lotus Temple in Woodstock. And I'll put the link down below, but there's a difference between relaxation and mindfulness. If you do singing bowl, if you do breath exercise, if you do nature therapy, if you shoot, if you run, all those things will get you calm, but it won't necessarily get the brain to practice mindfulness. When you practice mindfulness, the brain works better, and even if it's just 15 minutes, 5 minutes in fact, twice a day, you will still allow the brain to grow versus getting hammered with stress and shrinking the brain. So dementia can be worsened by stress response, unanswered stress response, no love, even to the point of abuse. So the idea would be practice mindfulness like a monk. And if you're not sure what that means, you probably should get somebody to coach you. You don't have to go to Bhante, you can get your psychologist. Psychologist is supposed to help you with coping skills, work as a sounding board, but also it wouldn't be unheard of to ask your psychologist, if you are in therapy, to teach you some mindful practice before the next visit. So that's the first thing, and it takes time. So sometimes when you have when you're deep rooted in anxiety and then you try to sit still, it'll make the anxiousness worse. So be forgiving to yourself, get some coaching, and try it just a little bit, bite-sized approaches. every day for 21 days until you get used to it. And get a coach. Number 2 would be eating, thinking, eating activity. So I think you should be training or eating like an Olympian. If you've watched Usain Bolt, the day after he wins the Olympics and sets the world record, he's already training for the next 4 years. So he is deep-rooted in trying to extract everything out of his mitochondria, out of his gut, out of his muscles as he can, as a human can. That's very admirable. Obviously he's retired now, but that kind of work ethic and that kind of paying attention to the fuel sources that you eat would be very important. So if you are thinking that your McDonald's is saving you time, that's really not fuel. If you can't use it to fuel your muscles in a sport or in a test, then you probably shouldn't be using it. So if you need help with regards to which diet, how to use it, macronutrients, get help from a registered dietitian that's well versed in eating and fueling. You might end up with a standard nutritionist. You might want to search out your lifestyle coach and squeeze out as much as you can from nutrition. You don't have to be a millionaire either. It just begins with making proper choices. The last thing is going to be activity, and the easiest thing I can tell you is pretend you're a pregnant mom. And if you're doing that, you've seen pregnant moms walking around slowly, taking breaths, avoiding Advil, Tylenol, smoking, alcohol. I think all those footsteps are important to get to 9 months and have a baby that's healthy. I don't think it's too much to ask to pretend that you're a pregnant mom. So if you avoid toxins, is what I'm getting at, then I think you'll fare better. Those things, and that's very confusing, but sometimes grains will be wrong. The animal fat or the animal protein that you might or might not be thinking is healthy might be the wrong thing for you. You don't have to be vegan. You don't have to be a paleo or keto guy. You don't have to be an intermittent faster. But I think it's important to avoid the crappy stuff, embrace healthy living, and again, pretend like you're a pregnant mom. If you do that, in addition to the thinking and the eating part, I think you'll be bulletproof. But it does take time. So again, give yourself a wide swath of time. Allow yourself to fall off the edge every once in a while, but don't stay off the edge too long. Again, if you have coaches on your side, that is going to mean Western medicine with insurance, but it really means a lot of non-insurance approaches. So you do have to invest, and if you can't afford it, that's fine, but beg, borrow, and steal. Look up friends, check out the internet for wise coaches in your area, and look for deals. There are always coaches that are giving things away for free. Myself, I'm a lifestyle coach, and I'm going to start moving away from Western medicine, moving into health and lifestyle. But I think it's about time that we have enough doctors and we have enough medicines, way too many medicines. We need more people to invest in helping others change. So hopefully this gives you a little bit of a Sunday Q&A. I'm going to be doing something for my young guy with the TBI, getting down into the mitochondria. So move over to YouTube and subscribe to me if you think it's helpful. Otherwise, I'll see you next Sunday.